Ah, yung kasama po yung Taytay El Nido and Puerto Princesa referral system. So currently, what we need is a referral system for the local health system alone of Puerto Princesa. So we are inviting all of the hospitals for this para po to gain their insights, to gain their inputs, and as well as voice out their concerns with regards to the referral process po that we have. Um, Yun po, a quick disclaimer. This is a for Puerto Princesa and Palawan will also have their own referral system kasi po basically it will be different na po from Palawan and Puerto Princesa. But basically after this we just need to uniform it to have it uniformly with the Palawan na local health system. So let's start. So this is to give you a brief introduction. This is in line with the Universal Healthcare Act, which was signed last 2019. Actually, dapat po ito ay nagawa na noong 2019, but because of the pandemic, everything was put on shelf, put on hold for COVID response. But right now that we are transitioning into the new normal, unti-unti na rin pong bumabalik and ini-implement na po ulit yung Universal Healthcare Act. So basically, yung naka-highlight po, yan po yung, ito pong apat yung goals and yung ng Universal Healthcare Act. But I want you to focus on the highlighted points. First is the universal healthcare is a model that provides a comprehensive set of quality and cost-effective services. Hindi, the universal healthcare will be will not only focus on the curative aspect but also in the promotive, preventive, curative, rehabilitative, and palliative health services. And yung isa po dito, without causing financial hardships. Meaning po, with the universal healthcare, every Filipino is already enrolled in PhilHealth. So hindi po cost na yung, it should be that there's no financial hardship po with the patients from having their own, from the services that they need. And the third bullet, whole of system, whole of government, and whole of society approach. Meaning, hindi lang po kami dito sa City Health Office should be the one implementing the universal health care, but it's a whole of system, whole of government, and whole of society as a whole. So whole of society meaning it's not just the public sector, but also the private sector. That's why we are inviting and engaging not only po the public hospitals, but also the private hospitals and the private civil society organizations, because with the universal healthcare, we see it na hindi lang po kasi kaya talaga ito ng public. This is a whole of society approach for us to implement the universal healthcare. So in universal healthcare, the goal, there's actually in the implementing rules and regulations po of the universal healthcare, dalawa lang po yung sinasabi niyang goals. And one is to progressively realize the healthcare in the country. There should be a systemic approach and clear delineation of roles between not only the agencies but the stakeholders towards a better performance of the whole system, of the whole healthcare system. And secondly, which is I think more important to every Filipinos, is that the universal healthcare ensures that there is equitable access to quality and affordable healthcare goods and services, and they are protected against financial risk. Next is our focus po is kasi nga po ang focus natin sa workshop will be referral. So ano ba yung batas na ano ba yung nakasaad sa batas kung bakit po natin kailangan yon, or ano po bang sinasaad ng batas? Sa section 18 po of the universal healthcare, under the individual based services, the PhilHealth po shall endeavor to contract public, private, or mixed healthcare provider networks, which I will explain later on, for the delivery of individual health services, provided that the members' access to services shall not be compromised. All the members of the network should agree to service quality, co-payment or co-insurance, and data submission standards, as well as during the transition, PhilHealth and the Department of Health shall incentivize the providers that will form the network. And then lastly is that we should be able to identify apex and referral hospitals as determined by the Department of Health and is contracted by our healthcare provider network. Second, under also of the Section 18 is that the PhilHealth shall endeavor to shift paying providers using performance-driven, close-ended prospective payments based on disease or diagnosis-related groupings with validated methodologies without differentiating facility and professional fees. Differential payment schemes also give due to consideration to service quality, efficiency, and equity, and institute strong surveillance and audit mechanisms to ensure networks compliance to contractual obligations. Just to give you a brief explanation on this, kasi po wala pa po talagang guidelines na nilalabas yung PhilHealth. Wala pa pong guidelines na nilalabas yung Department of Health or yung Commission on Audit on how this would happen. But we were the Vice President of PhilHealth has talked to us about this, pero hindi pa talaga siya final, wherein kayo po kasi naka-case-based groups tayo, yung reimbursements natin is based only on case-based, and yung Z groups, Z benefits po, di ba? So with the shift of the universal healthcare, there will be a shift of the provider payment mechanism na una, it's prospective, meaning po hindi kahit po nasa hindi pa po nakakalabas yung pasyente, baka pwede na pong gamitin because it's prospective. And then yun po, it's diagnosis related groupings. We are not just focusing on the case alone, but on the diagnosis related groupings na po, which is a different groupings na po from the cases that we are used to with the current system po of PhilHealth. But basically, yun po ay usapan pa lang, and what's important is before PhilHealth will implement those, we are ready. The hospitals and the whole healthcare provider network is ready in case na the PhilHealth will be implementing those, especially here in Puerto Princesa po, because we are one of the universal integration sites. Basically, yun po, Puerto Princesa po kasi is a universal healthcare integration site, meaning we are one of the 58 local government units that committed to implement universal healthcare. Currently po sa buong Pilipinas, hindi po lahat talaga nag-implement pa po ng universal healthcare. But there are just some LGUs po, and Puerto Princesa is one of those LGUs na mag-implement po ng universal healthcare. And one of this is yun nga po, pag sinabi nating integration, yun po yun po yung pag-aayos. We are doing strategies para po ma-implement po fully yung universal healthcare sa ating LGU. So one of the integration, kasi po may tatlong integration, that is financial integration, yun nga po yung with PhilHealth. There's also clinical and managerial integration. Managerial integration, hindi naman po, that mostly focus on our part as in the public sector, but dito po papasok sa clinical integration, which is the third part of the integration phases in the universal healthcare. Yung hospitals, yung public sector, wherein in clinical, pag sinabi po natin clinical integration, the Department of Health sees it na dapat po we are able to provide comprehensive set of services from primary care to palliative, meaning kasama din po doon yung rehabilitative, yung curative, promotive aspects should all be one, and meron po tayo nun and may ibibigay po natin sa lahat po ng taga Puerto Princesa through established systems po of referral, quality management, and holistic patient care. And in addition to that, in clinical integration po, it's yung primary care po, the primary care providers, whether it be doctors or nurses or midwives, they will act as the coordinator and navigator of patients throughout the integrated system, which I will be discussing further later. So the challenge po, here in Puerto Princesa, we all know we have 4 hospitals and 1 level 1 hospital, that is the ACE, and then 3 level 2 hospitals, the rest of the hospitals here in Puerto Princesa. And for us in the City Health Office, we are planning to have 5 primary care facilities, one in Napsan, another in Luz Biminda, another in Macarascas, and the other one is in San Rafael. So those are the primary care facilities. Plus yung the urban center po, which is here in the building po na that's constructed in Santa Monica. So bali po, yun po yung primary care facilities and the hospitals. So what is the challenge po with us? Is that yun nga po, the hospitals, we don't have level 3 hospital here, and the LGU does not have its own LGU managed na hospital. That's why kung kanina po yung pinag-uusapan natin is that we should be able to ask, siguro kung ano po kasi for us, hindi po kami dapat po, we are mandated to provide the whole spectrum of services. However, because we cannot, because we don't have funds for to build a hospital, we are mandated to do partnerships with private hospitals as well as to other public hospitals in here for us to be able to provide the whole spectrum of services. So that's the challenge po for us kasi yun, which I will be, kasi po nga na dapat po yung networks, I will show you a graph later na there are 2 models lang po. There's a public model wherein lahat po ay ng network ay nasa public sector lang, and then there's a private model. But here in Puerto Princesa, we cannot do that. So we will be we are gearing towards a public-private model of healthcare providers. So the local there are 2 terms baka kasi malito po tayo. There's the local health system and the healthcare provider network. So by definition, the healthcare provider network is a group of primary to tertiary care providers, public or private, that offers people-centered and comprehensive healthcare in an integrated and coordinated manner, in which yun nga po, the primary care provider acts as the navigator and coordinator of health within the network. But if we say the local health system, this is the organization of the people, institutions, and resources accountable for the delivery, management, and financing of health services to meet the health and health-related needs of the population. Meaning, yung healthcare provider network, yan po talaga yung dyan po papasok yung primary care providers such as us po in the sa yung mga primary care workers po natin, also yung ating mga physicians, primary care physicians po na and then papasok din po dyan yung mga specialists and yung mga hospitals po. Pero pag sinabi po nating local health system, it is a much more bigger. Kasama na po dyan yung PhilHealth, andyan po yung iba pang institutions that provide yun nga po mechanisms for us to deliver the healthcare. So this one is a gusto ko lang po i-emphasize, a province or citywide health system may form a part of or encompass more than one healthcare provider network. depending on land area, population, or service capacity. We are seeing nga po because yung Palawan po, they will be creating din po a province-wide health system on their own, separate from us. So, dyan mag-a-arise kasi yung question whether pwede ba yung isang hospital ay part ng dalawang healthcare provider network or ng isang health system. So, pwede po because yun po, it may encompass the province-wide may encompass or form a part of a healthcare provider network. So, pwede pong part nila. So, the healthcare provider network. So, meron pong basically dalawang parts ng healthcare provider network. Those who provide population and individual-based primary care services, and those that provide general inpatient care services. So, those that provide population and individual-based care services are the primary care facilities such as the rural health units, the clinics of our primary care physicians, of our doctors, also can be classified as primary care facilities. Additionally, there are health stations, birthing homes, standalone laboratories, pharmaceutical outlets, and dental clinics that provide population or individual-based primary care services. While in general inpatient care services, they are classified as infirmaries, and then hospitals. So the healthcare provider network should at least have one level 1 hospital that provides secondary care, and then another hospital that provides tertiary care at either level 1, level 2, or level 3 hospital. So pag sinabi po nating primary care facility, kasi po basically pag magpapa-accredit na po tayo na ating mga clinics and ating mga facilities, yun nga po, separate yung sa hospitals. But basically, on the part of the primary care providers, those nag-clinic po. So, the primary care provider, the primary care facility needs to have a pharmacy, a diagnostics, and laboratory. Basically, yun po yung requirement ng primary care facility. They should provide these services, laboratory, diagnostic, and pharmacy. If hindi naman po nila hindi naman nila ma-provide, syempre clinic lang po yung kaya nila, they can undergo a memorandum of agreement with other facilities, parang pharmaceutical outlet or diagnostic lab, wherein sila po yung ka-tie up nung primary care facility. And another thing po, the e-consult in here, it's basically kasi po primary care facility nga po, or in PhilHealth, that's what we call the consulta package po, or yung outpatient comprehensive package is now called consulta package. So they also are requiring the EMR system. So basically meron na po dapat yung primary care facilities natin ng EMR system, and that EMR system is interoperable with the EMR system 2. Meaning kung ano po yung laman ng EMR system 1, kung ano po yung nilagay natin sa EMR system 1, it can be seen to EMR system 2. They are very much compatible with each other. Pag nag-encode ka naman sa EMR system 2, makikita din po sa EMR system 1. Yun po. So, sabi nga natin, di ba, the primary care facility is the one that navigates throughout the healthcare provider network. Meaning po, kailangan po, if a patient comes in and magpapa-check up po sila, so they need to go to a primary care facility first. And then if the primary care physician or the primary care provider thinks na kailangan po niya ng referral, it is the primary care facility that facilitates the referral. One, it can be on towards the specialist clinic or to the hospital. So just to give much more palayo tayo ng palayo. So yun po, 'di ba? We are more focused on the healthcare provider network. So if we are the patient, meron pong dalawang klase lang naman ng concerns meron tayo eh. So that would be emergency and the non-emergent or most of the concerns. If the patient is having an emergency po, they can go directly to level 1 or level 2 hospitals or to the level 3 hospital kung saan po yung malapit sa kanila. But for other concerns, non-emergency concerns, they should seek um, po check-up at the primary care facility. Wherein the primary care facility nga po has diagnostic, has pharmacy, and may laboratories po sila. And also, in the public sector, the primary care facility is the one that supervises the barangay health stations under their jurisdiction. So, ito po yung ano natin dati. If you look at the left side, or this is the model that meron tayo dati. Usually po, dati primary health providers, and then pupunta sila sa laboratories or special medical services, and then bago pa sila mag-hospital. Mangyayari nga po, ang dati nangyayari, di ba, magpapa-check up, tapos i-work up sa isang hospital. Tapos, ano pala sa isang hospital, hindi pala nila kaya, so lilipat sila ng hospital. Tapos, pag hindi pa rin kaya, lilipat pa sa Maynila. So, marami pong talon-talon yung patient. But now we are focused on the right side, wherein the primary health care provider is the one that should be referring. So, if at the primary care level, nakikita na po natin na ang patient, ang need niya pala ay nasa Apex Hospital or nasa very specialized na hospitals, they don't need to go to level 1 or level 2 hospitals. They can go there, they should be referred directly to the hospital that is capable of treating those kinds of those diseases. So as para po hindi na nga po para po hindi na magastusan yung pasyente, at pangalawa, para hindi na po mapuno yung ng unnecessary patients po yung ating mga hospitals. So dito po ito po yung models ng primary ng healthcare provider networks that we have right now. This is the public healthcare provider network and the private healthcare provider network. Usually po in public healthcare the public HCPN, syempre po, it's more of the geographic or the political boundaries, meaning the public healthcare provider network of Puerto Princesa, assuming na meron pong hospitals, is composed of the primary care facilities that we have, and then our hospitals, and then the tertiary hospital, and then the Apex Hospital. But in private hospitals, in the private network, not necessarily yung ganun. As long as it's, kasi mostly naman po the private in the private setting, syempre mostly are market-based forces yung kung ano po yung boundaries nila from each other. So there can also be private individuals, private hospitals, private tertiary care providers that may form in their own healthcare provider network. But to give you focus dito po sa Puerto Princesa, because yun nga po the challenges, we have limited hospitals, especially here in Puerto Princesa. We don't have a public na level 1 hospital. That's why we are focusing na dapat po mixed or public-private owned yung healthcare delivery po natin. What do we mean by contractual arrangement? So dito naman po, kung meron pong kulang, kung may kulang po, like for example, may kukulangan po sa public services, we may contract services from the private healthcare providers para po makumpleto po yung set of services that we are needing to provide, yun po, the complete set of services to our patients. Ganun din po when it comes to the private healthcare networks. Kung meron pong kakulangan sa kanila, they can have a contractual arrangement para po magbigay din po yung complete na set of services na kailangan po ng patients nila. And basically, pag nangyari po yung contractual arrangement, it's kind of mixed na public and private owned. Siyempre may parts doon na public, may parts doon na private. just for us to be able to provide the complete set of services. If you can see, aside from those that provide primary, secondary, and tertiary care, meron pong Apex Hospital. The Apex Hospital is a hospital that is a stand-alone, meaning po hindi po siya parte ng kahit anong healthcare provider networks. Pero the Apex Hospital are mostly the specialty hospitals na magpo-provide po ng specialty care, yung very specialized na care if needed. So the Apex Hospital also are with contractual arrangement with each of the HCPN po. Ayun. So far po, before I continue, baka may questions na po kayo. Doctors, baka may questions po. Okay po, if there are no questions, I will continue po with the presentation. So, with that in mind po, we will be, there will be creating a healthcare provider network. So, under the Department of Health Memorandum at the Admin Order 2020-0019, there are requirements for the network with its members para po maano po natin yung healthcare provider network, para masabi po na okay po yung healthcare provider network natin. One is that all the member facilities po of the healthcare provider network should be licensed and accredited. Secondly, there should be a service capability profiling of all the members, meaning ano po yung kasama doon, that's an annual health facility profiling, a directory. The healthcare provider network should provide a directory to the Department of Health. And that third is based on standards, the primary care facility, there should be a primary care facility that should be 30 minutes away from the patient, and then the hospital should be within 1 hour. Next is that there should be a primary care based coordination, meaning in this one there should be localized referral protocols based on clinical practice guidelines in consideration of the local context. Ito po yung pinaka-bulk ng ng gagawin natin, is that we should we should craft a referral protocol wherein kung ano po ba yung dapat natin gawin when it comes sa mga patients natin, whether it's private or public, private practitioner referring it to a hospital, or a public from the public sector referring it to a private, ano po ba yung dapat na sinusunod nating protocol based on the current clinical practice guidelines. And then there should be an interoperable electronic medical record system among all the health member facilities. Remember po that what we are aiming for is universal healthcare. And then kung meron po akong pasyente or meron po kayong pasyente na sa hospital, gusto po sana natin yung records niya from the primary care provider, makita po natin at the level of the hospital para po mabigay po natin yung tama pong, syempre para makita po natin yung history, para makita po natin at mabigay po natin yung tamang treatment sa ating patients. So the electronic medical record system that is used by all the hospitals and by us by the primary care providers should be interoperable. And lastly, with the primary care-based coordination, there should be available ambulances and patient transport vehicles for the catchment populations for each of the providers. Next is that standard processes of communication. Ganun din po when it comes to communication, di ba po, coordination. Pag makikipag-coordinate kayo, there should be a standardized process on how we will be referring. So, appropriate communication facilities available for contact operations that the hospitals and the providers should have at least a phone or a radio communication, and then standard communication tools. The administrative order is also recommending a use of a communication tool, like for example the SBAR tool, um, para po pag nagre-refer po tayo ng patients, uniform po. And also, doon po sa referral form na gagamitin natin, uniform po yung data na kailangan. And additionally po, ngayon po required na aside from the tagubilin or follow-up instructions, there should be a back referral form. Remember po that if you are a hospital, you after ma-discharge po ng patient, kailangan po kasi i-coordinate siya back to the primary care provider so that the primary care provider, there should be a back referral so that the primary care provider is informed of the diagnosis or what you have done, and also para po for the continuation of the treatment ng patient. And then lastly, there's a local call center or chat hotline for health in compliance with the Executive Order 56. This is yung 911. So meron naman po tayo niyan. So kailangan coordinate lang po ng healthcare provider network yun. Itatap lang po natin yung kaakin yung 911. Next po sa requirements are network-wide health facility operations. There's an integrated fund management, included pooled fund management, provider payment mechanisms, unified price structures of services, and accounting processes across component facilities. Ito po medyo mahirap. So hindi ko po alam kung hindi pa rin natin ito magagawa for now. Or kasi po, pero as far as I know, the unified price structure of services, meron pong nire-require sa mga hospitals na HFPA, na mag-submit. Alam ko isa yun sa mga requirements yung mag-submit sila ng prices. So yun po, mukhang doon po papunta po yun dito sa unified price structure of services. Ito pong pooled fund management, yan po yung special health fund. And yun nga po, kunwari magkakaroon po tayo ng, kunwari nga po may contractual agreements po with each other or with other facilities, there should be a uniform process, accounting process para po hindi po magulo. But this one, I don't think this would be tackled not until later next year kasi po we are expecting for the PhilHealth and the COA to provide those guidelines by late next year pa po. And then maintenance team in charge of local capital asset management, meron po yan for private. So sa amin naman, this is for mostly sa public naman po. And then unified supply chain inventory, only for essential medicines. And then systematic healthcare, yung healthcare waste management po for the whole network. And then there's a unified client satisfaction surveys and patient engagement forms. So yun po, we will be also tackling this on the workshop itself. Unified patient safety programs. And lastly is capacity building and mentoring activities of all the facilities within the network to improve the service capability of all the providers. So just to give you a brief background po on the financing ulit, kasi I know we are all merong agam-agam when it comes to the financing. In the public sector po, all the funds that we will be getting will be in the special health fund. Either it's from the international or national government or non-government agencies, or from the DOH, the LGU, or the PhilHealth. It will go to the special health fund. And for the private providers, it will still be the PhilHealth that will be providing reimbursements for the individual based services. But as you can see, meron pong broken line between the special health fund and the private providers. Remember kanina, we are telling that pwede pong magkaroon ng contractual arrangements between the private and the public sector. And kung meron pong yun nga po, may babayaran or may mapag-uusapan po na mapag-aagrihan sa MOA, we can use the special health fund to fund po yung mga mapag-aagrihan with the private providers. So basically, it's still PhilHealth, and actually it will be PhilHealth that will be providing all the financial mechanisms for the healthcare providers. So, ito po, kasi ang nakikita po natin, pag hindi ka po, so Kyle, ito po yung criteria para sa network para po mabayaran po ng PhilHealth. So, the healthcare provider network should have a juridical personality, and then there should be mechanism of dividing funds, and then there should be a menu of charges implemented across the network, including professional fees. So these are the ones that are required for us for financial integration. Lastly, the healthcare provider network evaluated. So these are the ones that will be evaluated for the network. One is the health outcomes, including so there should be a network-wide morbidity and mortality reviews, compliance with PhilHealth, and then patient care and responsiveness na outcomes. There's also utilization of the primary care providers as the entry point of care, appropriateness and timeliness of referrals, patient satisfaction, compliance to basic accommodation requirements, adherence to clinical practice guidelines and referral protocols, and accessibility and adequacy of health facilities and human resources for the catchment population. So the HCPN may partner, yun, paulit-ulit po na the HCPN may partner through contractual agreements with facilities to complement nga po yung kakulangan sa service capabilities, and that there's an apex hospital to be linked with the healthcare provider network to provide the specialty healthcare not expected for us na nasa lower levels of care. And lastly, there should be a link with the drug abuse treatment centers, blood centers, and other specialized healthcare services. Ito po, I think this also is one na relevant po for everyone. The administrative order also states that all hospitals, whether public or private, shall have a public health unit to provide population-based services and patient navigation. So the public health unit shall ensure that the hospital policies are aligned with national public health programs to ensure surveillance and reporting of notifiable diseases and ensure proper referral and navigation of patients within the hospital from primary care to the higher levels of care and back to the primary care. So in terms of public health integration, the universal healthcare is focusing more on this, especially on epidemiology and active surveillance and health promotion, creating resilient communities. Yun po yung isa rin sa mga focus din po ng universal healthcare. It's giving a health, making more Filipinos health literate and providing Filipinos with an conducive environment for health, and then provide full spectrum of services without financial hardship. So for public health units, for level 1 hospitals, there should be one health education promotion officer and disease surveillance coordinator. Iisa lang po sila, na isang tao lang po yung HEPO and disease surveillance coordinator in a level 1 hospital. And there should be a care navigator, which is a nurse or a social worker, and an admin staff. For a level 2 hospital, hiwalay na po yung HEPO natin and then disease surveillance coordinator, and there should be an added disease surveillance officer in a level 2 hospital. in addition to the care navigator and administrative staff. And in a level 3 hospital, aside from those the staff in level 2, there should be a public health advisor for the whole the public health unit. Basically po, ano po ba yung goal natin with the workshop? So yun nga po is to our goal is to achieve clinical integration. So one is our objectives is to answer and provide the service capability profiling for us to know the capability of our healthcare provider network. And then ito po, i-finalize natin yung primary care-based coordination and standardize our processes of communication for referrals. If kaya pa po, ito po yung some of the network operations such as unified client satisfaction surveys, unified patient safety programs, and lastly is to apply it because the workshop po that we will be doing on 21-22 is in coordination with USA TBTFA. So we will be applying it most especially for the TB patients that we will be getting in our hospitals. So this is the program of activities that we have: orientation on the HCPA or on the universal healthcare and its mandates on the healthcare provider network. Some orientation din po on the financial integration, updated status of the local health system maturity, and then we will be reviewing and updating our referral manual and the case categorization. So sa pasok po sa referral manual ay yun nga po, basically yung procedural, kung paano po yung referral, ano po yung ilalaman ng ating mga logbooks for referral, ano po yung referral form, and then yung case categorization po, dyan basically is, for example, anong hospital, if you get it, or a primary care provider gets it. What is the case categorization, and if it's diagnosed with some kind of disease, so ano po siya, is it kailangan ba sa specialist level or A1 or A2, a specialist level or general practitioner level, pwede na po. So that's under the case categorization, so we have to do that. And then on the day 2, we will be finalizing it, and then basically yun nga po, the client satisfaction survey and logbook for the referrals. And then yun po, creation of the HCPN committee, and then on the third day with other stakeholders, so hindi naman po lahat na, so we will just be inviting you po for days 1 and 2. For days 3, it's more focused on the TB na po. So it's focused on the TB patient referral flow, TB information system, and agreements po with other stakeholders with in TB program. So yun po. With that, we want you to please, if you can, please answer po this one. Accomplish the online facilities directory, which can be seen in bit.ly/ppchcpn directory, and then the materials for the workshop can be accessed through ppchcpn. Mas maganda po sana before tayo sa referral, magpunta po sa referral para po mabilis lang tayo and makaano na tayo, is you comment already and provide your comments, and then check po sa referral manual po. We have a draft. Basically, the draft is we just based it on the previous version with the Taytay El Nido Interlocal Health Zone. And then please answer the best practices, strengths, gaps, and challenges that you are seeing in when it comes to the aspect of referring and coordination, basically. And then yun po, check the manual draft and the case categorization for referred cases, which can be accessed with the PPC HCPN. Yun po, mas maganda po makita na po natin or makomenta na po natin agad yun. Kasi po basically what we want sa case categorization is, if you are this hospital, will you be able to receive these kinds of patients? Yun po, mga ganon klase. If yes or no, kasi kung hindi po hindi nyo po matatanggap ng with higher levels of care, probably pag mga ganun na po, i-coordinate na po siya sa ating Apex Hospital. Ayun po. Thank you for listening. Yun po. Maraming salamat po sa oras. Alam ko po busy po kayong mga doctors. So maraming salamat po sa pag-attend po nitong orientation and kind of orientation na rin with Universal Healthcare and the Healthcare Provider Network. So our references is the DOH nga po, Administrative Order 2020-0019 and the Department Memorandum 2019-0235 and the Universal Healthcare Act. So now I'm opening the floor po for any questions. Just please raise your hand so that you can be acknowledged for any questions po and clarifications. So now I will be, so there's a, ayan. May mga, ayun po. May mga questions po tayo.
Question. Question. Ano ba?
Doc Ralph, Dr. Evelyn Ponolas is manifesting her interest to provide input.
Yes. Oh. Sir, I would like to ask lang. Kasi you mentioned all the services that the private hospitals and the government hospitals.
Basically po, pag na-ano po natin siya, pag na-craft na po natin yung referral manual, syempre hindi pa po siya perfect when we will be doing it and we will be finalizing it on
hindi pa ako tapos sa question.
September 21 to 22, hindi pa po siya perfect. So we will be,
No.
we will be, yun po, testing.
Sir, I'm asking on the side of the private hospital.
Natin, and we will see kung ano po yung mga improvements na kailangan po natin gawin.
Doc Ralph.
And then, yun po, may mga additional.
Hindi niya ako naintindihan.
Doc Ralph.
May mga additional pa po tayo.
Doc Ralph.
Meetings.
No, Doc Ralph.
Pero ano na lang po, mga refinement na lang din po.
Parang hindi niya naririnig.
Doc Ralph, pasuyo lang. Doc Ralph.
Yes po.
Doc Ralph.
I'm not yet through with my question.
Yes, Dr. Naintindihan ko po. Parang may audio input po si Dr. Ralph, hindi niya naririnig yung mga participants.
Opo, dito naririnig si Dr. Ralph po. Wait lang po.
Pwede na?
Doc Evelyn, Doktora, sorry po, nagsasalita. I cannot hear you. Wala pong
yan, naririnig mo.
Dating sa akin. That's why, sorry, I cut you.
Yeah.
Pero,
Doc, meron na po. May audio na po ang participant sa'yo.
Clear na ba? Clear? Can you hear me, Doc?
Pakilagyan ng audio si Doc Ralph.
Wait lang.
Yung mga kasama niya, ang mag-off ng audio input.
Ayun.
Para yan.
Doc, sorry po talaga, Doc. Wala audio kanina. Pasensya na po. So, na-cut po kaya.
Ngayon, naririnig niyo na, Doc?
Yes po, Doc.
Yung question ko, since you mentioned all the services that the private hospitals can offer to the patient, ngayon, ang question ko, how about naman yung sa part ng private hospitals? For example, ano ang guarantee that the PhilHealth will pay all the expenses that the patient incurred during hospitalization? Since we know now that the PhilHealth has a very big or huge amount of credit to all, di lang ilang hospitals, too many hospitals. Paano ba yon? Halimbawa, yung MOA ba namin, pwede ba naming i-cut yun dahil hindi naman na-meet ng PhilHealth yung part niya, hindi niya nagawa yung part niya? Like sa Cebu, di ba, parang dati umabot sa ganon, yung parang dinidetach na nila yung ng mga hospitals doon sa PhilHealth because hindi nila binabayaran yung mga hospital. So, is there a guarantee that the PhilHealth will really pay the private hospitals? Kasi kawawa naman yung mga private hospitals, ang daming nagsasara dahil hindi nababayaran. So that's my question, Doc.
Thank you po, Doc, for the question. Ganito po, syempre I cannot speak for the PhilHealth, pero what I can speak po for is the Special Health Fund. So if the patient po na ni-refer po sa inyo would be coming from a public or from us, we can do it po na sa memorandum of agreement po natin na gagawin with the Puerto Princesa po. That can be an assurance po na we are the ones paying you and not PhilHealth. And parang PhilHealth will pay us, and the corresponding prices that we would be the corresponding prices na mag-i-incur po ng patient with the hospital will be coming from us. Pwede po yun. Or with regards to that one po, when sa payment po, yun din po yung dilemma namin right now kasi po the PhilHealth, and we are still waiting for PhilHealth and COA to release their guidelines regarding po sa payment mechanism nila with the new payment mechanisms that they will be providing po. Kasi it's really a big difference po sa kanila sa provider payment mechanism. One, it's prospective na nga po, hindi lang yung parang reimbursements lang ang mangyayari. Second is, yun po, magbabago po sila ng case-based. Hindi na po sila magiging case-based, but disease-related groupings na po yung gagamitin. So for that po, I cannot give you an assurance po because it's still under the it's with the PhilHealth po eh. So we will be, pero that's a good thing po kasi especially we are constantly communicating with them with our issues as an integration site para po maparating din po namin yung mga hinaing po ninyo, especially in the private sector.
And then yung sa contract kasi, dapat naka-state din doon na kapag yung isa nagkaroon ng breach of contract, pwedeng kumalas. Kasi hindi lang kami ang magpo-provide. Dapat yung government part, meron ding, gagawin din niya yung part niya para maging successful yung MOA natin.
Yes po. Yes, ma'am.
Thank you.
Probably, Doc Ralph, I can give some insight on the use of the special health fund, which will be released through the local government unit. Kasi most likely, once the special health fund will be released to the local government, we may include the allocations for the private facilities payment. Kasi which is usually po, kahit sa atin ngayon, ang nangyayari po kasi is post-payment based on the services given by the facility, whether it is private or government-owned facility. Ang nangyayari po is after na ng services, saka nagbabayad ng PhilHealth. Pero the difference of having the special health fund, siguro Doc, pwede mo sila mabigyan ng idea. Although we don't have the specific guidelines yet on the use of the special health fund.
Ay, yun po. Thank you, Ma'am Ann. Yun po kasi, Doktora, meron din po kasi yung tinatawag nga po na Special Health Fund, which is a pool of funds coming from DOH, from our non-government agencies, and from us sa local government. So lahat po ng funds na yun, and PhilHealth also, will be pulled into a special health fund. And yun nga po, pwedeng, kunwari po may patient nga po tayo na, like for example, kasi lahat naman po tayo ay merong allocated beds for charity patients. And our charity patients, syempre hindi naman po makabayad din. And pero syempre, hindi mo naman mapilit din magbayad kung wala din talaga po. So what we can do is we can provide po provisions on that. Kasi po the special health fund is really for the operations of the healthcare provider network. Meaning po hindi lang po yung facilities, hindi lang po kami in the public, yung mga primary care facilities lang po na hawak ng Puerto Princesa LGU, but also we can use it to fund yun po mga ganong cases po sa sa buong healthcare provider network. Meaning, kung sasama po tayo sa healthcare provider network, pwede po natin yung gamitin. So, hindi po, not necessarily yung sa PhilHealth nga lang po.
Thank you.
And an additional lang po, kasi ang ano po natin, di ba, magka-healthcare provider network. The Hospital ng Palawan po kasi is aimed to become a standalone facility, to become the apex hospital po here in Palawan. So, ayun po. That would be another challenge for us kasi if they will become an apex hospital. So, we don't have, for us to become a healthcare provider network, we need to have at least one level 2 and one level 1. So kung they will be separate from the healthcare provider network of Puerto Princesa, then yun, kailangan po talaga namin ng tulong from our private hospitals. Kasi kayo rin po yung re-referan namin ng cases prior sa kanila kasi po we cannot go to the apex hospital without kung kaya naman po sa ating mga other lower levels of care na hospitals.
In addition lang po for the clarifications ng Special Health Fund, gaya po ng binanggit ni Dr. Ralph, ay yun pong paggamit nun, may involved din po kasi one of the members ng Local Health Board, Expanded Local Health Board, will be coming from the Palawan Medical Society or the facilities involved na may involved po sa Expanded Primary Care Provider Network within the city of Puerto Princesa. Kaya most likely, pati po yung utilization of funds will be given and shared to all members po, including the private facilities. Kaya po, ang totoo, majority of the members kahit sa Pharmaceutical and Therapeutics Committee for the Universal Healthcare, may mga members po talaga na will be coming, mandatory members coming from the private facilities. Kaya po, lahat na magiging actions and legal proceedings po may involved din ang members na to coming from the private facilities po. Salamat, Dr. Ralph.
Thank you po, Ma'am Ann. Ay, sige po, Doc. I-change lang po namin yung ano po. Maraming salamat po for that. Yes po, Doc Karen. Hello po.
Hello. Hello, Dr. Ralph. Ang question ko lang is, kunyari, para lang ma-visualize ko ng maayos. Kung kunyari may isa kayong case na turn out to be severe pneumonia, so admissible. So since wala tayong city hospital, you would refer that either to, kunyari, naging apex hospital na ang naging apex hospital ng ONP. So mangyayari since kailangan dumaan siya sa level 1, level 2. So among our hospitals here, ang bagsak ng pasyente na yon sa private before going to ONP. Tama? Pero among yung sa mga DOH na memorandum, parang may binanggit sila na all private hospitals should have 10% of their bed capacity allotted for charity. Tama, no? So kung kunyari, for example, pedia ward, so may 10 beds allotted for yung charity cases. So doon namin ilalagay yung referral ninyo. Parang ganun ba?
Pwede. Apo, Doc. Pwede po. Actually, Doc, that's one of the things that we have to finalize. That's now we have to talk about. Pwede, kung ano po talaga, walang-wala, we can do that. Pero kung yun po, yung patient is willing to pay, pwede po silang mag-private. Pero i-refer namin sila as private. Pero kung pwede po namin sila kung walang-wala po talaga, like for example, galing Kabayugan, wala po talagang doon, Gida area. Tapos we will be referring them as yun po, as yun nga po, charity din. So we just have to set the mechanisms how we will be referring. So kailangan po alam natin or klaro po with the private hospitals kung sino po yung papasok doon as charity patients na i-refer namin.
Yeah. So once merong charity ko yan, charity ward, and by charity cases, syempre meron dapat consultant assigned to handle that charity cases. So in a tertiary
Yes po.
hospital, madali siya kasi meron silang mga residents. So given here in Puerto na wala pa naman tertiary hospitals na may residency training, it will fall on the private consultants na to handle that charity ward. So kailangan siguro kung kunyari in our pediatric department, kung sino yung willing na magkipag-partner sa inyo would be the one decked to handle yung charity cases. Tama, no? Or pag nakipag-partner ang hospital, lahat ng consultant within that hospital, parang partners nyo na. Ganun ba yun? Or
Doc,
individual
yun
dito?
po yung Doc, yun po yung ayan po yung mga points of clarification that we could talk with para po sa para po doon sa referral. If you want it that way, we cannot impose anything po naman. I think personally, in my opinion, we cannot impose anything sa mga private hospitals. So if that's a thing that you want po as a hospital, we can raise it po during the time na we are making yun po. That's the point po ng workshop, is really to point out yung mga ganong scenarios po. Kasi so just so na clear po siya with everyone na nandun po sa hospital. So I think that's a good point din po to consider. Pero pag ganun naman po kasi, pag sa individual po kasi yan, di ba po, may individual cases and individual based cases, and yung patients po with yun po inpatient inpatient na patients, they will be reimbursed then po by PhilHealth. Basically, aside from what they will be getting from us, pwede po yun i-file nung ano po, pwede pong i-file ng hospital for PhilHealth claims.
Hindi, kasi yung question ko lang,
So,
i-refer ninyo yung case. Tapos akala nila pupunta sa private. Pero magde-demand sila ng specific consultant na, ito gusto kong consultant kasi nasa private kami. Parang ganun ba? Or parang yung sa charity ward sila, kami ang magde-deck ng consultant for them. Kung sino yung on deck on that week or particular week, kasi wala naman kaming residents in training na mga physicians. Parang ganun.
Okay, Doc. Nagets ko na po, Doc. That's the role po of the care navigators. Kasi po, the doctors po, yung patients po natin will only have yung talaga pong magmamanage sa kanila is their primary care provider. So, pagdating po sa hospitals, wala po silang mamili. Kasi pag ni-refer po sila, dapat po yung the primary care provider, magsasabi na po siya, either the physician or the midwife or nurse na magre-refer, na we will be referring you to this hospital, tapos ang magiging doktor po ninyo is si ganito. Which is naman po yun. Pwede naman po. Kasi that's part of being the patient navigator po of the of us in the public sector. Also, if the primary care providers, like for example, the primary also in the private, kung sino po yung magre-refer, tapos i-refer nila to this hospital with this doctor, that's na rin po yun. Prerogative na rin po yun. For us, hindi naman po siguro kami ganun, we agree on that na mag-aano na lang din. Kung sino po yung on deck on that week, siya na lang din po yung sa hospital na yun would be the one that would be caring for the patient. Kasi hindi naman po. Yes,
hindi, may sabang question. If ever man kunyari OPD, yan, OPD case, like for example, nag-refer ka ng nephrotic syndrome, so dapat nephrologist na makakita sa kanya. So pwede rin ba, kunyari i-refer mo siya sa private hospital, mag-create kami ng schedule na kunyari for a specific specialty. Kasi ito yung naalala ko sa mga tertiary hospitals sa Manila. So kunyari, Monday may nephrology na clinic, Tuesday merong hematology cancer clinic. So parang ganun na lang ang easier way kasi na magdadagsa sila on days na parang
every day. Yes po, Doc. Maganda pong point yun, Doc, na pwede nating pag-usapan during that. That's also part po ng role namin as the patient navigators, ng primary care providers. As kami po yung mag-i-instruct sa patient, especially kunwari nga po, outpatient on an outpatient basis, kailangan silang i-refer sa specialist clinic. So we will be the ones na mag kay ganitong doktor during this time kasi dito ka namin ni-schedule. Kasi kung hindi ka pupunta sa ganitong time, sisingilin ka niya. Ganun. Mga ganun po,
parang
pwede
ganun.
naman po. Oo.
Yun lang. Actually, yun lang ang tanong.
Apo. Doc, thank you po. Na-take note po namin para ma-take up din po sa patient coordination. Salamat po, Doc, for the points na considered. Thank you po. Doc Ronnie, hello po. Good afternoon.
Hi, good afternoon, Doc. I would like to clear po regarding the program po, no. Ang medyo nagigets ko kasi is that parang this program is focused more on the charity patients o yung mga indigents. Does this cover every Filipino?
Yes po. Yes po, Doc.
Kasi
And
parang yung system is naka-focus lang doon sa walang pangbayad eh. Doon sa hindi makakabayad. For example, ang question ko is, yung pasyente able to pay, gusto niya dito sa ganitong hospital na ma-admit or makita, control ba yung universal healthcare doon? Pangalawa is, anong magiging partnership nito with the HMOs? No, meron bang, kasi like sa PhilHealth ngayon, with the HMOs, what they're doing right now is that pag sa private, ikakaltas yung PhilHealth and then the rest will be paid by the HMOs. Ganon yung system. Now, pagtatanggalin natin, babaguhin natin yung system, ano yung magiging involvement ngayon ng HMOs doon sa program nito?
sige po. Thank you po, Doc. For the first question po, ang question niyo po ay kung may isang patient po na willing to pay tapos gusto po niya sa ma-admit sa ganito, tama po, ganun po. Sa isang hospital.
Apo, correct po, correct.
Sa private.
Pag ganun po, Doc, is it emergent? Ang question po doon ay, is it emergency or non-emergency? So kung non-emergency
For example, pareho po. For example, emergency. Tapos, siyempre, most of the time, halimbawa sa isang munisipyo, nakita na siya sa Brooks Point, for example. And then, sabihin, hindi namin kaya to dito, ililipat ka namin sa Puerto. No? Does the patient have the right to choose the hospital o yung network mismo ang pipili ng hospital for him?
Doc, yung private care provider po niya dapat yung mag-facilitate po nun. So kung hindi po siya matanggap, dapat po, Doc, kasi ideally, hindi na po siya i-refer sa Brooks. Diretso na po sa Puerto kung alam po ng private care provider na hindi po kaya doon sa Brooks. Basically, ganun po siya. Dapat hindi na po kasi maglilipat-lipat po yung patient. So, dapat it falls with the primary care provider po, Doc. Yung ano po na kung saan po siya dadalhin talaga. So, kung makausap niya po yung primary care provider na dito po siya i-refer, I think that's pwede naman po. Pero that's also a part, Doc, na pwede nating pag-usapan kung ano po yung like for that kinds of issues, yun po yung ano po ng workshop is one of the goals po ng workshop para po ma-clarify natin.
May dagdag lang ako dun, Sir Ralph, regarding dun sa issue kasi na ganun. Kasi, for example, like, pag ganun kasi yung system natin, pwede kasing doon sa mga primary care provider, magkaroon na po ng parang agreement, lalo na yung mga private hospitals, kumbaga parang kinuntsaba na nila lahat ng private care provider na dalahin sa specific na hospital.
Opo, Doc.
So
May
parang
collusion, Doc.
oo, may ano na, may sindikato na dito sa amin lahat yan No, ang ano ko kasi doon is that it should be fair to all private hospitals that lahat ng ire-refer should be divided to all hospitals, hindi lang yung dahil yung mga private care providers dito ay nakakatanggap ng suhol sa isang private hospital na nila dadalhin. So, nagigets nyo po yung ibig kong sabihin.
Opo, Doc. Agree po ako doon, Doc. Kaya po siguro ang maganda po doon ay maglagay po tayo ng provision sa referral manual when it comes po sa mga ganyan, mga collusions or mga other things na dapat na magpo-provide po ng fairness po to all the providers. Kasi po basically, Doc, ang ano po sa as a universal integration site, wala po kaming pina-follow na specific guidelines. We are tasked po na to create our own, and it's just the Department of Health will just check if it's fit. So kung nagigets ko po yung point, Doc, and I think that would be a very good point na dapat po maglagay po ng provisions when it comes po sa fairness po ng referrals po.
Kasi Doc Ralph, another issue that I would like to give is that yung Universal Health Fund, kapag napunta kasi yan sa mga politicians, that can be used actually to their campaign, instead na equally distributed to all to all patients who really need it. Kapag nahawakan ng politician yan, doon na lang sa mga sakop niya ibibigay yan. So may mga problems din na ganun.
Sige, Doc, sige po, ano po yun, Doc, noted po yun. Pero as of now po kasi the guidelines, I cannot answer specific and concrete to give you specific and concrete answers because wala pa po talagang guidelines na nilalabas yung special health funds, especially with those ano po. So I will just make sure po, Doc, na I will just update you kung ano po yung sasabihin po ng guidelines po ng COA and ng PhilHealth when it comes with that. Kasi po kahit kami po hirap din kami to start to give you information about the special health fund kasi yung guidelines po galing sa taas, wala pa po kaming hawak. Pero once po meron, I'll make sure po na to inform you po. Doc, yung sa second, ano po yung second question? Sorry na.
Yung sa HMO po, Doc.
Ayan sa HMO. Yung sa HMO po, ang sinasabi po ng Universal Healthcare ay the HMOs should devise ways to complement po yung ibibigay po ng PhilHealth. So they are tasked din po on their own na dapat po sila po yung magko-complement nung po nila, nung ibibigay po nila. And then it will not overlap with reimbursements po ng PhilHealth.
Thank you, Doc.
Sige. Thank you din po, Doc. Meron pa pong ibang questions?
Question?
Yes po, Doc.
Question ko, di ba nag-aalat kayo ng kunyari 10% for every private hospitals for charity, no? So halimbawa may ni-refer kayo doon as charity. For sure, wala naman ng karapatang pumili yung patient kasi charity siya, no? Beggars are not choosers. Yun yung rule natin, di ba? So halimbawa na kung sobrang taas na ng bill niya, na nag-exceed na siya sa PhilHealth at sumobra na rin siya sa budget niyo, mag-out of pocket ba siya or Paano yun?
Ah, Doc, meron pa rin pong ibang financial grants na pwede pong ano. And that's what the part of public health units come in po, Doc. So one part yung public health units po natin as yung care navigators po, 'di ba? Naalala niyo po, meron pong care navigators. One of their functions is really to help the patients po look out for ano po, not just to coordinate but also to provide po the necessary care. So kung they are in need po, they should be referring them not only po sa kunwari from hospital to hospital but also to institutions that can provide them financial assistance po. So,
Hindi, halimbawa, wala bang ceiling yan? For example, naging ilang milyon na, sasagutin pa rin yan ng government? Yun yung question ko. Kasi imposibleng wala kayong ceiling, mauubos yung
yung sa
funds niyo.
po, Doc. Yes po, Doc. Yung sa Special Health Fund po nga, Doc, wala pa po kasing guidance sa amin kung magkano yung pwede naming i-allot for medical assistance. Mga ganun po, Doc. So I cannot really answer kung yung mga ceilings and specifics po na number when it comes to that. But yun po, yung for us to be able to find ways as nasa ano po yung public health units nga po is to find ways po for us to have the patients incur no out of pocket expenses po. So that doesn't mean po magtitigil na po kami or yung care navigators po with yung bibigay nga po na LGU counterpart or ng PhilHealth but also yung sa iba pa pong institutions that can provide financial assistance. That yun nga po siguro dapat kasama na rin po yun sa sa mandate din po ng mga alam ko po kasama din po yun sa mandate ng mga care providers is to really look out for to refer them to institutions that could provide them financial assistance.
Kasi hindi lahat kaya eh. Hindi lahat kaya kaya mare-red flag na 'yon. Ibig sabihin nai-stop na yung pagbigay ng private hospital sa mga needs niya. Hindi naman pwede kasing ang private hospital aasa na hindi babayaran naman ito eh. Ang tanong diyan kung mababayaran ba, how much, kailan, mga ganon.
Opo, Doc. Tama po kayo doon, Doc. So, ngayon po, Doc, i-take note namin yung question, i-send po namin sa proper na kung sino po yung masagot, maybe it's one of the central office na offices.
Hanggang saan? Kasi dapat may ceiling din para hindi naman aasa yung mga pasyente. Baka kasi akala nila dahil sinabi ng government, all-out support hanggang sa kaduluduluhan. Kawawa din yung private hospital kung malulugi siya.
Apo, Doc. And actually, Doc, pag nasa private hospital, Doc, yung required lang po, hindi nga po pwedeng nasa private room. Yung talaga pong ward accommodation, basic accommodation lang po yung sinasabi na pwede pong bigyan ng patient no, yung sa 10%. If they are in the private rooms already, hindi nga po rin yung kasama. Pero Doc, yung question niyo po.
Yung mga gamit, yung mga gamot, yung mga facility, yung room, wala namang problem ang room. Pero yung mga meds, kasi di ba pinoprovide yun ng private hospital na ibibigay sa kanila para matreat talaga sila. Paano kung umabot na nga doon sa millions? Kasi may mga kasong ganun na akala ng pasyente, naiintindihan niya na hindi, under naman ako ng UHC dapat wala akong babayaran. Baka from the start dapat masama yun sa orientation na hanggang ganito lang ang ceiling para at least alam din nila yung move nila na hindi sila aasa na lahat ipoprovide ng private hospital.
Yes po, Doc. Actually, Doc, kung maalala niyo po, that's why the payments nga rin po is perspective and disease related. Meaning po, siyempre iba-iba rin naman po kahit po sabihin natin na pareho sila ng sakit, parehong pneumonia for example. Pero may nagka-pneumonia na may comorbidities na 65 years old, mayroong comorbidities. Iba po yung gastos noon. Sa isang 19-year-old na malakas na wala pong ibang sakit, wala pong ibang comorbidities. Tama po?
Yes.
So, one of the things po nang ibinibigay po ng sa PhilHealth po, yung disease-related groupings, is that they also take into consideration those comorbidities, yung age nga po, and yung sex, yung mga risk factors, they also included na po sa magiging reimbursements. And also it's prospective, meaning po, bibigay, yun nga po, prospective, mauuna na po siya ibigay. So may idea na din po kung magkano po yung ibibigay ng PhilHealth. And yun nga po, pag sumobra,
Stop na.
so,
Mag-i-stop na rin yung
pero
private. Lulugi siya.
baka kailangan ilipat or something. Pero I'm really not, I cannot answer you, Doc, na ano po, na close.
Okay.
Kasi po, that's I think I will still have to consult this
Yeah.
with the central office, and we'll give you answers po, Doc. Hopefully they can answer us before the workshop para po mabigay ko
Thank
rin
you.
yung answer. Yes po, Doc Karen.
Hindi, may question lang kasi, di ba sa government, meron silang no balance bidding? Kaya din ba nilang gawin yun sa private?
Doc, actually, Doc, tinanong ko nga yan kanina with the PhilHealth, pero wala pa po silang, wala pa po sila daw ganun na provisions na kung pwede daw po yung no balance billing sa private na charity patients. Kaya hindi ko pa rin po maano. Hindi ko po
Madaming magsasara pagka ganun.
po. Kahit 10% lang, medyo malaki din po talaga kasi
Oo.
ng total bed capacity.
Yun lang. So wala pang answer for that. Sige, note na lang natin.
Doc. Natanong ko na yun, tinanong ko agad yan kanina, Doc, kasi I'm expecting that it would be asked din.
Okay. Thank you.
May questions pa po tayo from other doctors. Thank you po talaga sa pag-attend po nitong ating meeting kahit po short notice lang.
Okay.
So, sa mga questions po natin na remained unanswered, we will be forwarding those questions right now para po pagdating po ng workshop, we can all move through it naman po. And thank you po for those wonderful points kasi po we really need your help kasi po we really don't, ako personally, wala po ako experience sa private hospital. So I'm not sure kung paano siya, paano yung galawan. Pero yun nga po, kailangan po kasi siya kailangan po namin kayo with the universal healthcare kasi po kayo po yung magiging backbone ng ating primary, secondary and tertiary care services for Puerto Princesa. And yun po yung kaya po namin din gagawin siya is we want it na with you in mind. So that's why we are inviting you to do the workshop kasi po katulad po ng mga ganyang issues with regards po sa private facilities, we can take that into consideration while doing po the referral so that hindi po siya masyadong mabigat sa inyo, and hopefully you'll take the referral and the whole universal healthcare wholeheartedly po. So maraming salamat po. So may questions pa po. Yes, it's the Karen.
Yeah. Hindi, kasi di ba, ang mangyayari, other than the PhilHealth, city ang gagastos sa mga, ang tawag dito, pagkakasakit ng bawat taga Puerto Princesa. Is it possible na kunyari sabihin natin na yung isang pasyente will get yung full benefits ng special funds ng city kung lagi siyang nagpo-follow, like for example, yung isang bata kailangan fully vaccinated siya. Kunyari, imagine mo lang kung fully vaccinated, then lesser ang chances na magkakasakit talaga yun. At saka lesser din yung chances na ma-admit siya. So, will that matter kung kunyari ang family na to, they adhere to yung mga sinasabi ng DOH, like magpa-vaccinate and all? Will they get parang full benefit as compared dun sa isang taon ayaw ayaw mag-follow sa mga primary healthcare advices ninyo? Meron bang ganon?
Unfortunately, Doc, pareho pa rin po yung
pareho-
magiging
pareho
treatment
ba?
sa kanila, whether or not. Pero one of the things na hindi po namin tinakal dito, pero one of the things po kasi is as in yung primary, we are equipping all the primary care providers for the consulta package. So the consulta package is an outpatient benefit package wherein we are requiring everyone to be registered to a primary care provider so that they should be seen at least once a year. So that's one of the health promotion strategies that we're having. And that would be reimbursed by PhilHealth if you are under a primary care provider.
Even for pedia, once a year lang?
Doc, at least once a year. So pag may mga patients po talaga, Doc, na required na mag-follow up po, yun po, pwede naman pong i-follow up and may reimburse naman siya. Pero yun, Doc, siya, Doc, parang on a yearly basis yung reimbursement ng patients in a primary care provider. So, ang questions pa nga rin po, Doc, like for example, if you are a specialist, can you still see patients? So, the question, the answer is yes. Pero pag nag-check up na po tayo ng natin, they should be referred back to a primary care provider. Ganun na po siya right now. We're starting to implement na po na ganun. Pag natapos po siguro yung coordination, ito pong referral manual, that would be very much of a help in referring back patients.
Okay, salamat.
Sige, thank you, Doc. Ayun po. May questions pa po tayo? If wala, yes, Doc.
None so far.
Yun po. Thank you po for the productive afternoon. So I guess we will be closing na po this session. Before we close po, can we open our cameras for some documentation lang po ng ating
Wala na nag-open.
Ayan. Para makita naman po yung mga magaganda at guwapong doktor po ng Puerto Princesa. Sige po, antayin lang po tayo siguro 10 seconds. Para po sa mga hindi pa po naka-open ng cameras, please open po your cameras. So that, yun po, i-document lang po natin tong meeting. Okay. Baka may hahabol pa po. Kung wala na, sige po.
Thank you.
1, 2, and 3. Okay po. One more, 1, 2, and 3. Okay po. Maraming salamat po sa lahat po ng nag-attend. And yun po, thank you po sa UHC PPC team. And thank you po, doctors, for attending this session with us. And hopefully po, reminders lang po, yun po, the workshop will be on September 21 and 22 at the U Hotel. Yan po. Maraming salamat po.
Thank you.
Sige po. You may now, ano po, interview. Salamat po. Oo. Mga 30